The pandemic is taking its toll on us physically and financially, but it can also be impacting our state of mind. At what point do we need to seek out professional help, and how do we do it safely in a time of social distancing? I spoke about it with Dr. Michael Nadorff from the psychology department at Mississippi State. Dr. Nadorff, obviously mental health is on the forefront of everybody's minds with everything that's going on with the pandemic and May being Mental Health Awareness Month. Are there certain aspects of mental health or maybe treatment that you think would be good to draw attention to right now?
I think there are a couple things that are really important right now. So first of all, even though we need to stay distant physically, it's really important to stay connected socially. We're social beings. So it's important to check in with each other, to keep those connections that we had before all this. I think another thing is that it's also a good time to seek out treatment. People are so afraid, of going out. I think even not because of fear of the virus, but fear of inconveniencing someone. We're still working. The mental health system is still here to serve you. And a lot of us have been able to move over to telehealth. So there is still support and help there, but so many people, just like with other parts of health, have been hesitant to reach out. So I really encourage people to still reach out, because these are challenges that really none of us have ever faced before. And so it made sense that we all may need some help during this time.
Do you know a lot of mental health professionals that have turned with that sort of telehealth approach and are doing that now?
Yeah, the vast majority of my colleagues and our clinic too at MSU have actually all started using telehealth. And I think all of us recognize that the world has changed. And this is now the way that all of us are going to at least have to partially operate. So I think it's also a unique opportunity for us to advance the field. And we've tried to go in with that mindset. But with that, these services are available, and they're likely to keep being available in this method going forward. So I think it really has pushed us to get into the 21st century.
Do you think that there are people out there who sort of are good where they're at mental health? Can everybody sort of get some improvement by seeking mental health help and focusing on that? What do you think?
Absolutely. So I think there are certainly a lot of us that don't, have a diagnosable issue. That's the vast majority. But I think all of us have had stress with this. I think all of us have had challenges with this. So with that, I think it's, first of all, good to know that's normal. That's, if you're not stressed with this, I'd be more worried than if you're stressed with this. And with that, just keeping in mind, it's the social connections, it's staying active, it's trying to keep as much normalcy as you can. Those things are going to have a huge impact on your mental health.
Right. Do you think that there are still as many maybe stigmas when it comes to mental health as there were, say, 50 years ago? Has that come a long way?
It absolutely has come a long way. And I've seen a lot, especially with the younger generation. So not even just millennials, but also the generation coming up. There's actually a real emphasis on prioritizing your mental health and being willing to invest in your mental health. So I've really been impressed with the younger generation, seeing not only an openness to seeking out services, but actually a commitment and being willing to put your money where your mouth is, essentially, with seeking out those services and maintaining that mental health.
Do you think there are maybe some positive aspects for mental health that could come out of this pandemic as far as people being maybe more open to communicate?
Absolutely. I think, there's always a silver lining. So for us, within the field, it's certainly pushed us into the 21st century. But I think it's also, for the rest of us, helped us realize what's really important and what are some of the things that are not as important. And I know for me in my own life, it certainly has done that. And so with that reprioritization, it helps you focus on the things that are that much more meaningful.
And something else we want to also mention too is that you're going to be on CBS this morning, this Sunday. Tell us a little bit about what you're going to be talking about and drawing attention to there.
So with all the stress that's been going on, a lot of people have been having COVID-related nightmares or bad dreams or just changes in their dream patterns. So we're talking about why that is happening and what steps people may be able to do to help alleviate those dreams.
What's it like to have that sort of national attention brought to your department, and sort of what does that feel like, and what good do you think can come from that?
It was really amazing to have them reach out to us, and I was really honored to do it. And I think it's really cool to get to see MSU and Mississippi put on that national stage, and for more to realize the expertise that we do have here, and also the work and the research that we're doing here.
Great. And before we go, do you want some final tips maybe regarding mental health, some reminders there of things that the people should keep in
in mind while they're going through all these changes?
Yeah. I think the biggest things are stay active and also stay social. Again, physical distancing doesn't have to be social distancing. So stay connected with your support groups and get out and be active. Do it safely, but you need to be active or else depression will creep in.
All right, keep that mind working as much as the body too.
Absolutely.
Dr. Nadorff, thanks so much for talking with us today.
Absolutely. Thank you.
And you can catch Dr. Nadorff's interview on nightmares and COVID-19 this weekend right here on CBS Sunday Morning at 8. The time